Good morning. My name is Sandra, and welcome to the Newgrad interview. I would like to begin with the first question. As a registered nurse, which factors do you think are important for team communications and documentation? Provide an example from your own clinical practice.
Good morning. Myself, Rama Bandari, student registered nurse from Western Sydney University. Thank you for the question, Sandra. I'm happy to share my clinical experience. During my clinical placement in Liverpool Hospital Respiratory Ward, I was assisting a female patient admitted with pneumonia and underlying dementia. She had history of frequent hospital admission throughout the morning. She had become increasingly confused and her respiratory rate increased and also her oxygen saturation dropped from her baseline. I was concerned about early sign of deterioration. That was a bit busy ward and several patients were requiring for assistance simultaneously. Working closely under the supervision of my registered nurse, I understood that effective communication between us and with healthcare team was important to ensuring the patient received appropriate care. And my responsibility under RN supervision was to conducting regular patient ops, documenting accurately in the appropriate chart, reporting any changes immediately to the RN, and participating in clinical handover using structured communication tools. I had to apply my theoretical knowledge in practice and ensure my communication was clear, concise, and clinically relevant to support safe patient care. I also had to communicate clearly during verbal handover. As I was learning, I also needed to understand the importance of documentation in forming part of patient legal and medical record. I first double checked the patient recent vitals and compared them to her baseline reading, which I reviewed in her chart, and I noted increase in respiratory rate 20 to 26 and drop in oxygen saturation 96% to 91 on room air. I first discussed the patient changes with my body RN. RN thanked me and assisted the patient immediately. Together, we updated the observation chart and I completed progress note under RN supervision. At the end of my shift, I gave handover. I used ISBAR framework to give verbal handover to the afternoon shift. Later that day, I reflected on the situation with my facilitator. My clinical facilitator reviewed my documentation and verbal handover and gave me a feedback on improving clarity and ensuring all key points were communicated. As a result of timely communication and accurate documentation, the patient was reviewed by the medical team within 2 hours and started on IV antibiotics. Her oxygen requirement was increased and she was placed on 4-hour observation schedule. The progress note and handover I contribute to help the afternoon team monitor her condition closely. This experience highlighted how effective team communication and through documentation directly impact patient outcome and safety. It it also helped me understand that documentation is not just a legal requirement, it supports continuity of care, clinical decision making, and interdisciplinary communication. I also become more confident in giving ISBAR handover and bring documentation in the system for the future. Important communication and documentation I learned are information must be communicated and documented as soon as possible to support early detection and intervention. Communication should be clear. Nurse should use ISBAR technique to make sure communication is clinically relevant. And effective communication requires listening and contributing to the team. And as a student nurse, I have learned that every piece of documentation is part of the patient legal record and must meet professional standards.
Thank you, Rama. The second question is, a fellow registered nurse has undertaken actions which placed a patient woman at risk of harm. What are the professional, ethical, or legal issues you would consider, and what actions would you take?
During my placement in Liverpool Hospital in complex surgery, I was assigned to care for a young male patient who had undergone a laryngostomy due to throat cancer and now had tracheostomy in pelvis. He was a humidified oxygen receiving peg feeds and required regular tracheal suctioning due to secretion. It was an afternoon shift and I was working under the supervision of my body registered nurse. Near the end of the shift, a relieving RN came to take over the care of the patient. I observed that the relieving registered nurse was unfamiliar with patient-specific airway needs. Shortly after handover, I noticed that relieving RN preparing to perform tracheal suctioning without following proper technique, especially the RN did not use sterile gloves and had not pre-oxygenated the patient and did not check the suction pressure. The patient began coughing and showing signs of mild distress, but the RN continued. I realized that this was placing patient at high aspiration risk. As a student nurse, I needed to act within my scope of practice while prioritizing patient safety. I knew I had a responsibility to speak up about unsafe practice in a respectful and professional manner to my body RN. My aim was to protect the patient from hypoxia, infection, and airway trauma due to improper suctioning technique without causing conflict. Uh, I took a calm and respectful approach. I stepped forward and gently said, "Hi, I just wanted to mention that when I assisted with this suctioning earlier, we were advised to use sterile technique due to infection risks. Would you like me to grab a sterile kit or let my body RN know?" She mentioned that she was used in ICU style closed suction system and wasn't aware that this patient requires sterile open suctioning. She reviewed clinical suctioning protocol and agreed to stop or re-prepare the setup using sterile equipment. I also informed my body iron together. We checked patient observation and he was mildly tachycardic and his oxygen saturation had dropped from 91% during the event and the patient settled shortly after. My body iron thanked me for advocating for the patient and supported me in completing a clinical incident in notification, which included education for future relief staff. No harm occurred due to the patient and oxygen level returned to baseline, and the tracheostomy site was monitored closely with no sign of infection over the following days. The relieving iron thanked me later. She appreciated that I raised the concern professionally without conflict. My clinical facilitator also thanked me for demonstrating critical thinking and advocacy as a student nurse. I gained confidence in speaking up respectfully and realized that how vital it is to protect vulnerable patients, especially tracheostomy patients. Professional duty, patient safety first. According to the NMBA registered standards for practice, nurse must provide safe evidence-based care and identify and respond to the risk. Even though I was a student, I was still part of the care team and needed to speak when I recognized danger to the patient safety. An infection, mucosal injury, hypoxia might result from improper tracheal suctioning. My action supported early intervention and maintained safety. I followed ethical principle of non-malfeasance, do not harm, and beneficence. I also demonstrated advocacy, a core of nursing value, especially the patient could not speak due to his laryngectomy and tracheostomy. Although I was not legally accountable for Iron's actions, I still had duty of care to raise concern if I saw unsafe practice. If harm had occurred and I had failed to speak up, I could have been questioned during any investigation. By documenting the issue and escalating to my body iron, I ensured transparency. NSW Health core value collaboration. I worked with my body RN and the relieving RN as a team. Openness. I was honest and about what I have observed. Respect. I approached the situation respectfully without blame. Empowerment. I felt confident to speak up and learn to trust my clinical judgment. Thank you.
Thank you, Rama. So the last question for you today is, how do the NSW Health core values of collaboration, openness, respect, and empowerment relate to your role as a registered nurse? Provide an example from your clinical practice.
During one of my placement in emergency department in Liverpool Hospital, a patient was brought in by ambulance after a motor vehicle accident. The patient had a fractured arm and deep laceration on forehead and was complaining of chest pain. As a student nurse under supervision of my nurse, my task was to assist with the patient triage, monitor vital signs, and provide ongoing care while the doctor ordered X-ray and wound care. I needed to make sure my actions are followed the core values. Collaboration. From the moment the patient arrived, I worked closely with my nurse, doctor, and the radiology team. I helped to take vital signs and assisted in applying oxygen when the patient oxygen saturation dropped slightly and make sure her arm was stabilized before transport to X-ray. Patient care was well coordinated between teams, which avoiding delays in diagnosis and treatment. Openness. In openness, we need to share important update and observation as soon as they occurred. Before chest X-ray result, I noticed the patient's chest pain was worsening and respiratory rate had increased. I immediately informed to my nurse and the ED doctor. After that, we did ECG immediately, which revealed some abnormal changes. The doctor ordered further blood tests, cardiac monitoring to find out more serious complication. If I had delayed and assumed it was just anxiety, the outcome could have been very different. After that, I understand clearly how openness directly impacts patient safety. In respect, we need to treat the patient with respect without cultural judgment, language barrier, and personal preferences. Because of the language barrier, we use the hospital interpreter services to explain each step of the care process, why we were doing observation frequently, why we needed ECG. I ensured privacy by closing the curtain during wound dressing and kept the patient personal item close to them so they felt secure. I showed respect for patient dignity, culture, and emotional well being. The patient felt safe and understood, building trust to the care team, and despite his language barrier. In empowerment, we need to help the patient to understand what was happening and involve them in a care decision. Even in ED, emergency department, I took the time to involve the patient in decision making. I explained their pain relief options via interpreter, which method patient preferred, oral or IV. So I showed them how to use to press the buzzer, and I encouraged them to let us know immediately if their pain worsened. When family member arrived, I introduced myself and shared the updates because of that patient felt supported. Patient was able to communicate needs, reducing anxiety, improving cooperation treatment. This case reminded me that NSW health core values are not separate, they are connected. Collaboration is more effective when there is openness. Respect helps patient feel safe to speak, and empowerment is only possible when we communicate clearly and involve patient in their own care. Applying core values ensure care is fast, safe, respectful, and patient-centered. As a registered nurse, I will follow this principle to every patient interaction, whether in emergency department or any other department. Thank you. Do you have any question?
No, that's it. Thank you, Rama.
Thank you, Niyanta.